Hello, nice to meet you. My name is Adam. I'm going to be your student physical therapist working with you today. Nice to meet you.
Me as well.
Before we get started, can you please confirm your name and your age?
Caitlin Morris, and I'm 24.
Perfect. Can I confirm that on your bracelet?
Oh, of course.
Perfect, Caitlin. And can you just tell me where you are?
University of St. Augustine,
And can you tell me why you're here?
to receive physical therapy.
Can you tell me who the president is?
Joe Biden,
And can you tell me what day of the week it is?
Sunday.
My patient's cognition is intact. Okay, Caitlin, so I saw in your chart that you don't have any contraindications to the treatment I have in mind today, and I also saw that you had a muscle sprain in your cervical spine, okay? But before we get into this intervention, I have a couple tests to screen to make sure that you're an appropriate candidate. In order to do that, I'll need you to remove your shirt, and I will be providing with a drape, and we'll need to just do a couple of tests and check the back of your neck, if that's something you're okay with.
That's fine.
Perfect. So let me get the drape ready for you. Maybe you can lift your arms up. I'm just gonna take it and like that. Perfect. Okay, so the first thing that we're gonna do is some sensation testing, okay? So I'm going to be lightly swiping the back of your neck. That's what it should feel like. When you feel that, just say yes, and keep your eyes closed and try not to guess, okay?
Okay. Yes. 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 Yes.
Okay, the sensation is intact. The next thing that I'll be doing is checking the skin integrity. Just checking the warmth right now. It appears to be a normal temperature, and I do not see any open wounds or scars or rashes. Okay, so that's all good. So you're going to be a good candidate for the treatment today. Before we get into it, can I ask you if you're wearing any earrings or any necklaces or jewelry?
Nope.
Perfect. And I can also see that she is not wearing any jewelry. So the treatment I have in mind for you today is a moist hot pack. And I have one more question to ask you though before we get into it. Have you been using any kind of ointments or creams like Tiger Balm or Icy Hot on your neck?
No.
Okay, perfect. So that means that you will be a good candidate for the moist hot pack. Basically what that is it's some clay confined into a pack that will provide you with comfortable heat. We will be providing that heat for 15 minutes, okay? And it will require you to lay down on your back on the table. During this time, you will be supported, and we will be using a call bell. And basically what the call bell is if you need anything during that treatment time, or you feel like the hot pack might be getting too hot, you can just ring the bell and we will come in and assist you, okay?
Okay.
So I'm gonna go ahead and give that to you now. And the benefits of this treatment is it will help decrease your pain, increase the flexibility, help with any muscle spasms that you might be having, and also improve your function.
Okay.
So does this seem like something you would want to participate in today?
Sounds good.
Okay. And do I have your consent to proceed?
Yes.
Perfect. So before we get started, I have to go prepare the hot pack. Are you okay to wait here while I go do that?
Yep, I have my call bell.
Perfect. So I'll be back in just a couple of minutes, okay?
Perfect.
All right, so I'm over here to prepare the hot pack. I will be using a cervical hot pack. And I will be using these tongs to grab it. And bring it over. I already have my cervical hot pack wrap placed up, and I will come back over and shut the hydroculator. Okay, so now I'll be placing this into the package. Now, since we're going to be working on the cervical spine today, I'll be using 6 layers between the hot pack and my patient. So this is going to be the first layer. This will be the second layer. And then I'll have 4 additional layers on top. 1, 2, 3, 4, for a total of 6 layers. Okay, let's bring this back. And in order to get the target treatment area, I will be facing the rounded edge downward. Okay, so what I'm going to do is I'm going to help you get up. I can take that for 1 second. And what I'm going to do is help you lay down, okay? So you can stand up. Perfect. Able to sit onto the bed?
Yep.
Turn. And let's lay down. Perfect. So I'm going to move the hot pack up just a little bit. Okay, you can go ahead and lay down. Okay. Is that comfortable?
Mm-hmm.
Okay. And during this treatment, you should expect to feel a comfortable warmth, but at any time if that gets too hot, just let me know, and you can go ahead and ring the call bell, okay? And someone will come help you. Let me get you fully set up here. So I'm going to give you a pillow for this arm, a pillow for underneath of this arm. Go ahead and lift up one leg. And go ahead and lift up that other leg. Okay, do you feel comfortable?
I do.
Perfect. So I'm going to leave for 8 minutes. Does that feel like it's choking you at all?
No, I feel fine.
Okay. So I'm going to leave for 8 minutes, and then I'm going to come back and check on you, okay? If you need anything, just ring that bell.
Sounds good.
Okay, it's been 8 minutes. How are you doing?
Great.
Perfect. So I'll be back in another 7 minutes to complete the treatment time. All right, so your treatment time's all finished. How are you feeling?
Good.
I'm gonna go ahead and take these pillows out now. This one. So then I can take that call down now. Okay, I'm gonna help you sit up now. Let me lower the bed down for you. How are you feeling?
Good.
How does your pain feel after that is over?
I think it went down a little bit.
Okay. So I will be checking the skin integrity one more time. Okay. So if you can come around here. I will be assessing the temperature. It is warm and I can see some normal redness or erythema forming, and that is normal and what I expect. I don't see any rashes or anything, and she said that it decreased her pain, so I feel like this is a treatment we can use in the future.